When you're in a canal, the worst thing that you can have is a file that wants to straighten up, because essentially you want it to bend with the canal itself.
Is there any use for NiTi K-files? Seems like stainless steel K-files can do pretty much everything. On the whole, do you think practices favor it because of simplicity and cost to use one file versus like the 4 different files you may have to use in another system?
You need to think about what is the whole point of shaping. So the whole point of shaping isn't, believe it or not, to scrape the sides of the wall of the canal. The whole point of a file is to create a space for the irrigant to flow. That's the most important thing. The irrigation is the most important thing in root canals. If you kind of get that into your head, and that is your philosophy.
Welcome everyone to part 1 of the Endo Showdown. It's Rotary versus reciprocating files. Which ones should we be using? And with none other than Protrusive favorite, Dr. Samuel Johnson, aka I Love the Pulp. If you didn't already check out the previous episode we did or his channel, you'll definitely want to after today. When I announced in the community that Dr. Samuel Johnson will be returning to the podcast, there was a lot of buzz. Someone even said that that was their favorite episode of last year. Obviously an endo geek. And so in the community, there were so many questions. So in the part 2 of this 2-part series, we'll have a rapid fire round of all these questions asked by the community, but you'll have to wait until part 2 for that. As in this part 1, we talk about decision making when it comes to rotary versus reciprocating, file mechanics, and all the geeky material science that we know you guys love. And Sam also covers all the pros and cons of these 2 systems. And obviously from saying that, you already know, therefore, there's no such thing as a perfect system. There isn't anything perfect in dentistry, but we owe it to our patients to do our own research and pick our battles and choose wisely our compromises that we make. And so after this 2-part series, you'll definitely walk away with more of an idea of, okay, how is your particular file system working at the moment? Is that benefiting your patients? What are you sacrificing by using your specific mechanism of action? We'll definitely gain that perspective from Sam today. Now, this is a PDP episode, and you do have your protrusive dental pearl. And the pearl is to remember that there's nothing better than natural bone. There is no graft material that's better than the patient's own bone. Okay, so how does that tie in to root canal? Well, sometimes you may be able to root canal treat a tooth, but you don't have enough tooth structure to restore it. Therefore, what do? We take out the tooth, we clean out the gunge, and we graft the area for a future implant, and that has its own challenges and disadvantages. But let us not forget, our friends, about the palliative root canal. The root canal you do to heal the infection naturally, just like any root canal does. And yes, the tooth will not be functioning, and you do still have a somewhat of a coronal seal, but it's not a functioning tooth. But once the bone heals naturally, because you've disinfected the root canal system, then when you extract it, that implant is so much more predictable. And sometimes this approach actually suits our patients because it buys them time to save up for an implant, for example. So don't forget or discount the benefit of a root canal, even for the unrestorable tooth. If you can treat the underlying infection, you will help the future prognosis. Let's now jump to the main episode, and I'll catch you in the outro. Dr. Samuel Johnson, welcome back again. You are a fan favorite, Sam. Oh my goodness. I'm going to just go straight into it. So those of you who didn't hear the previous episodes that we've done, honestly, Sam is just this super endo geek, but just one of the nicest people in dentistry. It's just so clear from your voice, from your smile, from your aura and everything. And no wonder everyone just loves you. I'm just going to read out some comments from the group. I literally said yesterday, oh my God, just over 24 hours ago, I said, ask your endo files questions. And 20 comments later, we have the likes of, let's see, Kostas Kolianidis. Sorry, Kostas, for bastardizing your name. I love his channel. If you talk to him, tell him I'm a big fan. Haha. Love the detail in the videos. We adopted many of his techniques. Here's one that's really cool, Sam. Charlie Shah said, I don't even do endo, but I love his channel too.
Yes.
That is a top one. Christopher said, great choice. His episode was one of the best of 2025. Hope this one beats it. No pressure. We talked a little bit about that before. He's got a real question afterwards, but we'll save that for later. And then the last one, which is one of my favorite comments, is from Ben Mullard. He says, can you let Sam know that his weekly Friday video is the highlight of his morning getting ready for work? There we have it, mate. I just wanted to shower you with that love.
I find that difficult to take love like that. I don't know why. Maybe it's just a thing with me, but it's really, really difficult. But thank you so much. The weekly, the weekly cases. But if I had enough time, I could do a case every single day. But I always choose the best. Well, do you know what? I always choose the one that has the most learning value. So I would say 50% of my cases I do on those Friday cases are cases that you wouldn't necessarily see someone put on Instagram. They're not Instagram ready. A lot of them are mistakes, essentially.
Well, that's why we love them, because they're raw and honest. They're authentic.
The most important thing is problem, how to solve it. That's the most important thing. So that's essentially how I choose them. So yeah, I wish I had a team behind me who could edit them and things. But I enjoy doing it. But it's a lot of work.
We need to talk, Sam, separately to help you get this team, and I can help you with that. But essentially, you mentioned the word problems, right? So a big problem in the endo world is decision making, especially when you're like obviously all things are challenging when you're newly qualified, but like trying to decide between files and file systems and trying to see beyond the marketing hype. And initially we thought, okay, should we talk about, Pro Taper versus this brand versus that brand? But actually, I think the main topic, obviously there'll be so many accessory questions like what the community have posted, but the main thing is, let's look at the mechanisms, right? There are Rotary and Reciprocation, and really going to do a deep dive into these two systems. Now, are there any more types of systems like in that broad level than these two, or are these two the main ones that we can just go further into?
I think these are the main ones, but what I would say on this is a lot of the time I use a kind of a hybrid system. So one of my very, very, very first videos that I did for the channel was on the Black AI motor, and the USP of that Black AI motor, I don't know if you're aware of the motor, is that it's something called T-mode. And there's a Japanese endodontist who's very, very famous for removing fractured files. His name's Yoshi. I can't say his second name, sorry. And he's developed this kind of T-mode, and essentially it's it sort of, the first kind of movement is kind of a watch winding movement. And I use this quite a lot for things like getting past, kind of this aberrant, canal anatomy. But it replicates your movements with a hand file, because with a hand file, you get that kind of tactile sensation, don't you? And also with these kind of 90-degree movements, they're not moving too far, so you're not risking this sort of cyclic or torsional fracture. And with this endo motor, once you kind of pass that kind of issue, the ledge or the kind of weird anatomy, you press the button again, and then it turns into rotary. So I suppose in a technical sense, that's a different type of motion, isn't it? But I think in the broader sense, reciprocation and rotary, they're kind of, I think that it's one of those questions that when I was first qualified when I first did my masters was, what do you use? It's not really a huge issue for me now, because once we get into all this, it's not just about the action, this kinematic kind of action. It's really a lot of things. It's about, what type of metal, the type of metallurgy of the file itself. Tape is a massive one, and also operator experience. I think that's another huge kind of factor when you're thinking about what type of file you're going to be choosing.
I agree, but also like going back to what you said there, like when you are newly qualified, I mean, that's one of the first big things you have to understand, the mechanism. And then as you evolve and as you learn more and you see things that you cannot no longer unsee, like I remember in my endo journey, I don't do much endo now, but in my endo journey, I started to follow these endodontists, and every time they were describing a file, they were like 04 and this. I was like, oh, okay, fine, that means something. And there's different numbers here, and okay, fine, there's more to that. And then they use it, and then they write the name of the metal that was used. And so it's like, wow, there's so much more to files than what I knew. And that's always evolving. Now, I don't know. I probably do know, actually. In dental schools, they probably have some sort of contract with this with big endo, let's call them big endo, that give their files to the dental school on probably a cheap or free, so that the students use those files, so that when they go out into the big bad world, they can use the big endo files, right? Now, big endo can be any company, big corporation, but their files are good, their files work. But kind of, we go out dental school, we only know this one thing. But in my dental school in Sheffield, we only use rotational. So just pause there and just describe for the students who are listening, basically, what is a rotational action? What is a reciprocating action?
So we need to bring it back slightly, because you need to think about what is the whole point of shaping. So the whole point of shaping isn't believe it or not, to scrape the sides of the wall of the canal. I can tell you now the amount of times I have comments on the YouTube channel about this kind of, there's a few cases where we've had these huge centrals that have got, they're probably maybe a ISO 200, and they're very, very thick. And then I have just used no shaping files at all. I've gone straight for the irrigation. And the amount of people are sort of the keyboard warriors who give me, you know, lots of criticism for not using files. Well, the whole point of a file is to create a space for the irrigant to flow. That's the most important thing. The irrigation is the most important thing in root canals. If you kind of get that into your head, and that is your philosophy, you're going to be getting,
Hence
you're
why
going
it's
to be having a lot of.
chemo-mechanical, right? That term chemo-mechanical
Exactly,
exists for that
yeah,
reason.
yeah. So with the Rotary, this was more of the traditional kind of action. This is the kind of the sort of 360-degree motion of this kind of. I call them cleaning instruments with the patient. I call it like a cleaning brush, and essentially you're just trying to open up or bore out enough of a diameter so the irrigant can flow. Now there's a massive bone of contention between how much you should open up the canal by to let the irrigant flow. I feel like there's a paper somewhere where a size 35 is your best kind of opening up for irrigant flow. I probably disagree with that. I think maybe using a combination of shaping, irrigant, and also activation. I use a ultrasonic activator, which kind of creates these kind of these ultrasonic bubbles that sort of let the irrigant get into all the little nooks and crannies things. So that's where that comes from, where the Rotary comes from, is to open up the canal space. And of course, you need to have traders. Reciprocation actually was first, from my understanding, it was kind of developed in the 1950s. It was kind of I think it was Micromega, which is a French company that had suggested this kind of 90-degree angle. It's nothing to do with the kind of reciprocation we get today. And then that was developed in the 50s, and then it was completely forgotten in time. And then there's an eminent dentist called Dr. James Rohn who developed this balance force technique. To what degree are you aware of the balance force technique, Jazz?
Now you've sent me back to my endo sort of workshops and DF1 and balance force, and like I feel like it's like you put your finger on it and then you maintain that finger position or something. But that's as far as I can tell you. So that's like in the last dying neurons in my brain.
So the balance force, it's one of those kind of like key words that you hear all the time, but you kind of think, oh yeah, the balance force second, but you're not too sure about essentially what it is. And then initially it applied to hand instrumentation, and it was keeping the hand instrument centered within the canal. And of course, they were using stainless steel hand files, and so we're using NiTi. Essentially, from what I remember,
just pause you there,
balance...
Sam. From my understanding, I just need to pause you there because I need to get some clarification on this. So you just said we're using NiTi hand files. Do you mean K files, or are you still talking about the actual systems like Rotary and the actual proper?
So Dr. Rohn was using stainless steel hand files. At this point, NiTi wasn't a huge thing that was used. I'm almost certain in 1985 wasn't used. It wasn't even about. I know NiTi was developed in the 1960s by the US Navy, and when it was developed, it was kind of. I'm also really, really worried that this file, I find this interesting, but I don't want to bore the listeners. Again, it's one of those things that was developed ages ago and completely lost in time. The balance force technique essentially is to keep these hand files centered. So it was concept about hand files. So with these really thick stainless steel hand files, essentially they were quite thick, so don't bend easily. So they had more propensity to open up and straighten in the canal. And what people were noticing was we were getting a lot of ledging, perforation, and things like that. So this balance force technique was a safer way of negotiating down a file. And there was an eminent paper by. I'm really, really worried about pronouncing this guy's name wrong. I think it's Ghassan Yared. He was a Canadian dentist who did this kind of eminent paper back in the early 2000s, where he sort of thought to himself that a rotary file essentially, or any endodontic file, has a certain point, a certain less elasticity before it breaks. Essentially, there was a paper that worked out how much you could twist a rotary file before it breaks, and his kind of genius idea was, what if we only cut up to that point where it's just about to break and then we release? And essentially that is just the sort of the area around reciprocation. So you're getting to the point where you're making a cutting stroke with a certain turn, but before it breaks, but before it's supposed to break, you can release it.
And so it spins one way and then it spins back to zero position, or like minus, like how do you know? Well, I mean, maybe too geeky, but like it goes one way, goes back the other way, whereas the rotation one just keeps going that one way, right?
I know the first paper, his reciprocation action isn't the same as, say, Wave on Gold or Reciproc. But after, and also it wasn't a dedicated file that he used it with. I think he used it with a ProTaper, maybe a ProTaper Next file, or maybe I think maybe it was actually ProTaper Universal that he used it. I could be wrong on that one. And then once he released this paper, it was kind of like this flurry of research then. Lots of dentists were brought in to try and develop a file that had this kind of, essentially this safer movement. And of course, another huge benefit, supposedly, of reciprocation files is it's got this censoring ability as well. So, it's taking lots of different, it's like a bit of an evolution, isn't it? From Dr. Rowan, who developed the balance force, to creating something that was a bit more mechanical.
And so before we then continue more about, okay, well, which one do you use when in rotary versus reciprocating, and what the current trends are, because already I can tell you that from my perception, a lot of practices and GDPs like to use reciprocating because it's like, I'll use the one file, it'll get me mostly there. And so it's a bit like any, I don't want to say maybe novice, but someone with less experience. Like there's a difference between someone who does endo occasionally versus someone who does endo all day long. And the nuances you may not appreciate. And sometimes you may use a system because that's what you know and you're comfortable with. And then it's a bit like if all you have is a hammer, everything looks like a nail, but the endo version, right? Whereby the hammer is the same file that you use because that's what just works for the 97 of the other cases. But actually, there's going to be 3 cases where it may actually cause more detriment. So I'm keen to learn that from you. But because you touched on the whole K-file thing, I'm just going to load it up now. One of the community questions, which you might as well address now, from Thean. Thean asks, is there any use for NiTi K-files? Seems like stainless steel K-files can do pretty much everything.
So I've got something to say about this. When I first, I'll bring it even further back. University, we were not shown using rotary or reciprocation files. Manchester University in 2009, we were all using hand files and the cold lateral compaction.
Even like ProTaper, like system, like for example, you were using hand files, but not even like ProTaper hand files, because we had ProTaper hand files.
No, I think they were just normal stainless steel K-files.
Okay.
And we were shaping up to 25. To do a molar endo like that, you need hours, essentially. But I suppose in a way I could understand where they were coming from, because it's still kind of seen as the gold standard, especially with cold lateral compaction, not with instrumentation. But it's kind of like the basics, isn't it? You kind of get it. I suppose that's what the university is for. So when I got to my VT practice, I couldn't have everything I wanted. The nurse asked me what I wanted. I thought that I wanted, I thought stainless steel hand files, but let's get the NiTi ones because they're more expensive. So that's in my mind. That's why I wanted them.
More premium.
They were premium. The pack came in a nicer package, and also when you bend them, they kind of flip back to the way they were. In my kind of, it's the same famous adage, is that you don't know what you don't know. I realized very, very quickly that if you've got a file which wants to bend back to its original position, if you get anything other than just a straight canal, you really are in trouble, and you really, really struggle. And I think when we talk about the history of rotary and reciprocation, the very, very first ProTaper files, the ProTaper, I'm trying to think what they call it, ProTaper Universal, essentially.
Mm-hmm.
They had that sort of shape memory. And I don't even think in the practice now where I work, or the other practice I work, we have any NiTi hand files at all. I think they're detriment to your practice. I think get rid of them.
Wow.
The thing is I'm also very I can never pronounce this. I think there's martensitic and austentitic. I
Yes,
can
yes,
never
yes.
say the two, but the austentitic is the one that is wants to one where it wants to keep the shape. And I think a lot of the NiTi hand files are this kind of, they're in this authentic phase. I'm not as pronouncing that very well. And I wonder if they do NiTi files where they're more Martensitic, or where if you bend it, it gets its shape memory. So I use high flex at the moment with a lot of the times with all my cases. And of course, I do mix it up a bit. And there,
Educate us. That is a rotary. It's a hand file. Or what is
it's
that?
a rotary. It's a rotary file, and it's been heat treated. It's also been cut electroplately as well. I don't understand that, but it's been heat treated. When these NiTi rotary or reciprocation files are heat treated, what happens is they go from their super elastic or synthetic phase, and then what it does is it changes into the more martensitic phase. And why that's important is because the martensitic phase is more flexible. When you're in a canal, the worst thing that you can have is a file that wants to straighten up, because essentially you want it to bend with the canal itself. Another weird property of martensitic files as well, before I forget, is that they're ever so slightly weaker than the authentic. Can I ever say it? The Ors phase. You'd think this was a bad thing, but actually, one of the main problems that we found with early NiTi rotary files is that there was no kind of safety backstop. And what I mean by that is these files just used to fracture just like that. But with these more softer rotary files or reciprocation files, when you are using them in the canal, every time I pull them out, I look at the flutes. And if you see the flutes are starting to unwind, that means that the file is just about to break, and that's why you can change it straight away. So, what you might hear that these martensitic files are softer, and their sort of torsional fatigue is their torsional limit is less. But what happens is it gives the ability just to unwind slightly. It's kind of a bit of a safety backstop, if that makes sense.
That's golden advice, to check under your loops and check your files periodically to see if you see any.
100%.
I mean, I learned that the hard way. I'm sure you have as well, mate. But I think that's a great point. And Thean, thanks so much for asking that question, because I didn't know. And sounds like Sam agrees that you can do pretty much everything with stainless steel. And actually, not just the fact that you can do everything and they're cheaper, but they're probably safer because they don't have that shape memory, which is what you don't want unless you're dealing with a super straight canal. So I think that one's been answered, which means we can now go back on topic to rotary versus reciprocating. Now, I already gave you this context or perception that in the real world, many clinics, for efficiency reasons and probably cost as well, is it cheaper for a clinic for a per case basis on an so many nuances here that you as an endodontist, you know too much. So you got to kind of simplify it. On the whole, do you think practices favor it because of simplicity and cost to use one file versus like the 4 different files you may have to use in another system?
So I would say, arguably, Flex is a one file system as well. So I was an NHS dentist
That's a
for
rotary,
a
yeah.
long
That's
while.
not
It's a rotary
reciprocating.
file.
Okay.
Sorry, yeah. I'll be more clear about which is which. I used that for a very, very long time on NHS. I thought that was quite a cost effective file, but I don't really use Wave One Gold, but I will tell people now, if you're newly qualified and you are looking for a kind of one file system, I would say Wave One Gold's a really, really, really good option for you. So there's a really good study that demonstrates this kind of experience over, newly qualified, about, is it well received? Is it well used? And a lot of the students and the newly qualified dentists that have used Wave One Gold or any reciprocation file, you kind of have this kind of sense of safety. The problem is with talking about just rotary and reciprocation. I would say that Wave One Gold isn't very grabby, but I think Reciproc is very, very grabby. That's another reciprocation file.
Grabby is a wonderful term because it kind of makes sense already what it means, but just make that super tangible. What is a Grabby file?
You put a rotary file or reciprocation file into a canal, and if it wants to drag itself into the canal, that means Grabby. Now, I personally, when I was first qualified, didn't like that approach. And though when I was doing my master's degree, and we went on the hands-on days, and I didn't like that. Now I like Grabby. I like the rotary file to want to go into the canal, mainly because I just feel like I don't like to push a rotary file in or a reciprocation file in, only because I've had my fingers burnt many, many times by fracturing it. But because I've been doing it for so long now, like I know the limit of the file that I'm using. Initially, when I went to my BT practice and I demanded these NiTi hand files, we also eventually got Wave One Gold, and I just felt like it felt nice. It felt safe, but again, it's really important that it's not to get complacent with that kind of safety. It isn't foolproof, and I have fractured Wave One Gold files early on.
Almost like a false sense of security. The fact that it's not grabbing doesn't mean that it's not doing a lot of removal, and perhaps removal in the wrong part of the canal that you don't want.
I mean, I think the very, very first file that I fractured was a reciproc file. I remember it very well because I was working on a Saturday of all things. Can't believe working a Saturday. And I remember what I was doing was I was just using it in the wrong way. I think I was using it at too much of a tight angle. I was sweeping it around, but I think maybe I had that false sense of security that these road reciprocation files are, they're kind of foolproof. I think another thing why it goes into like the kind of, is it better for a less experienced dentist? Is there something you've touched on? It's just a simplified sequence, isn't it? It's just one of those things where you just get the glide path and then use a one file system and then you're done. And I think 90% of the cases that you're going to be taking on as a new qualified dentist, they're not going to have these tight bends, not going to have any deep splits and deep joints. Another thing I would say though is I'm almost certain that that's another reciprocation file, that was specifically designed without a glide path. So what I mean by a glide path is that obviously a lot of the canals that you're going to be coming across, they're open, but a lot of the times they're going to be kind of blocked or calcified, or there's going to be kind of sort of aberrant pulpal anatomy that you obviously can't see because it's deep into the canal. I don't know if you've ever drilled a hole into a wall and hung a picture. What you don't do is you don't get the drill bit that you're going to be using to get the final hole, because essentially it's really hard for you to put quite a large drill into a hole because you'd be moving all over the place. And what you use is a little pilot hole, so you get a very, very small drill bit, and then you drill that
same
hole,
with
and
implants.
you use that to do you know what? I have absolutely nothing to do with implants at all. I have no idea that's what
Me too.
So that just shows me, doesn't it? My kind of my ignorance, as I just thought, they just drilled it in and
it's more universal. We get it.
So with a glide path, essentially you just want to make sure that the canal is patent. And what I mean by that is open. Because if you've got this big fat rotary or reciprocation file and it hasn't got that kind of hole to follow, well, it's just going to follow its own path, isn't it? It's going to cause a perforation. It's going to cause this transportation or a ledge or whatever.
Okay, well, so the glide path is mandatory, but when it comes to the decision making, if you can help us to, what we do in every episode, we make some premium notes and we really try and take some more from around the web to basically compile a good summary of the episode. If you were to imagine this imaginary table, and on one side it says rotational, and another side says reciprocating. Can you think of, or can you suggest any indications for example, a reason to use a reciprocating file would be you want a simplified system that's going to be more cost effective, and maybe you're new to endo, or you may disagree with that because maybe you need to be more experienced before you use reciprocating. But give us some for curved canals, use that. Now let me just break this down a little bit more, because one thing that whichever nurse or dental assistant that works with me finds very annoying about me is when I'm about to do a class 2 or an MOD or just a MO or a DO, nurses, when they begin working with me, they're like, hey, which matrix can you use for this? Okay. And I'm like, I don't know. I don't know until I know. I won't know until I've actually removed all the caries and had a look at the distance between one margin and the adjacent convexity of the tooth, and look at the height of where the contact needs to be, and all these little nuances, right? So I say, I'll let you know once I've done my cavity prep kind of thing. And nurses always look at me funny, like every other dentist I've worked with, they just know, okay, this is the matrix I use, just get ready for me. Whereas I'm like, I'll tell you, I'll know when I know. So I'm actually really fascinated by, is that the same with you endobods, right? Do you like open the access cavity and you know a little bit from the radiograph? Like I know mostly what I think I'll be using, but I'll only know once I'm there. So is that the same with you guys, or do you have like a system that, okay, you just know from the beginning, I'm going to be using these file systems, so nurse, please get this file system ready for this one? I would love to get that as well before we make the table.
So I'm going to probably give you a wishy-washy answer now, but I think it doesn't matter what if you use rotary reciprocation. Maybe I'm ruining the title of the podcast today, but it's certainly the evidence is not for one or other, and I just think it's basically down to personal preference. So there are obvious benefits of reciprocation, which, as we've already talked about before, there's that kind of apparent risk of cyclic and torsional fatigue. So what I mean by cyclic fatigue is when the file spins in the canal and it's going around a curve. If you imagine one side of the file is being repeatedly compressed and stretched, compressed and stretched, compressed, stretched, and that kind of tension compression cycle happens over and over and over again until these kind of like micro cracks occur within the metal, and then the break. And it's the like to think this is the paper clip analogy. So if you imagine you get a little paper clip and you bend it back into enough times, then you're going to break the paper clip. And so remember, cyclic fatigue is where the file is free to move within the canal space, but it breaks through this kind of repeated back into motion, and that's more likely to occur in a very, very bendy canal. And
but I mean, it's more likely to occur in a bendy canal. But am I right in saying that overall, especially in a lot of the countries we work in, because we do not use the file more than once on a patient, right? Therefore, one would argue that cyclic fatigue is rare because it doesn't do enough cycles.
Yeah, but also, people are human beings, aren't they? You can imagine, obviously newly qualified dentist. But yesterday I did an operator. I had 4 canals, 4 proper canals with their own pores of exit. It sometimes gets to the point where I've used a hand file a rotary file, a high flex file for a long time. And especially if, I've struggled to get down these canals and they've been quite calcified and difficult, I will look at the flutes and I'll see that they're perfectly fine, but I'll just replace it because I'm just concerned about this kind of cyclic fatigue. Because I'm always flying off the seat of my pants with stuff like this. But I remember in my master's degree, there was a limit of how many times a rotary file can turn, and I think that limit the number is very, very low compared to what you think. You think it just turn and turn and turn all day, but it hasn't at all. So that's something you got to be concerned about. And definitely when I was newly qualified, I obviously had I was using reciprocation and sometimes a bit of rotary. And what I used to do is I used to say, now I do 2-hour appointments with patients, but I used to split the appointments up into 2 1-hour slots. And then I used to keep the file for the same patient, not different patients, but for the same patients. Mm-hmm. So they used to be autoclaved. And then, we used to sort of sit in decon, and when the patient came back, we'd use the same file. I stopped doing that, mainly because I was just concerned about this fatigue on the file itself. Another type of fatigue, of course, is this torsional fatigue, where this is the stress on the file itself essentially exceeds the elastic limit of the metal itself. So that means that when you're using the rotary reciprocation file, it's usually the tip or the sort of binds with the canal, but the motor still keeps turning. And obviously that's the motor, if it isn't set correctly with this torque. So, when we're asking about how, the RPM and the torque, well, the RPM is how fast the file spins, but the torque is at what point will the motor keep pushing until it goes backwards.
So on Protrusive, we get asked geeky endo questions all the time, but one of the top questions we get is, which endo motor should I get? A good endo motor is so valuable, whether you're a busy practice or an associate who moves between practices. If you're doing a lot of endo, you'll value a good endo motor. We've teamed up with QU Dent to bring you a special promotion. It is the Endo Radar Pro. I had a product demo of this a couple of months ago, and the cool thing is that the head itself has got a free form rotation. That makes it way less awkward to read your apex locator measurement, because it's not only a motor, it's also an apex locator. And when you have a fixed head, it's sometimes difficult to read the screen. The freeform rotation really allows you to get better access to all the canals as far back and as awkward as you want. With other motors, you have to detach and then reattach the head, but this one has a freeform rotation. The other trend we're seeing that this satisfies that when dentists are nowadays buying endo motors, they no longer want the screen on the handpiece itself. That is getting too cumbersome, too fiddly to go up and down and try and get the right settings on the handpiece. So we've gone back to favoring a large screen, and that's what this one offers. Dentists want to be able to put the endo motor on the bracket table right next to you and see the screen and see the visuals. It makes it so much easier to toggle file systems, toggle speeds and torque. The motor then connects to the handpiece via Bluetooth, so there's no wires, which is great. So you still get the feel of a wireless handpiece, but all the settings are conveniently changed on the motor itself and not on the handpiece. Not to mention it's more ergonomic this way. The Endo Radar Pro comes with an autoclavable head. That's actually where you insert your file. But if you're limited to endo, you're a specialist, then you probably want to buy a couple of additional heads. The promotional price in total is less than £650. I say less than because I like to quote with including VAT always. And so once you do the checkout, enter the code, it'll be way less than £650. And there's another perk coming as well. You get to choose some free files. You can either pick solo files, which are similar to Wave 1, or you can pick M Taper, which is similar to Pro Taper Rotary. And when I was learning about these files, they've been sold for 7 years with an 80% customer retention. So now you can get a new endo motor, plus you get to try a new file system. So you get to choose Reciprocating, aka Solo, which is similar to the Wave 1, or you could choose Rotary, which is the M Taper, which is similar to Pro Taper. All of that with the discount and the files is done on the checkout. The website to claim this is protrusive.co.uk/endomotor. That's /endomotor. And as always, your coupon code is Protrusive. This offer is time sensitive, so in the first 30 days, that's when you get the best pricing, or until sold out. So check it out on /endomotor. Let's rejoin the episode.
That makes any sense.
But that torque, so this is again, that torque setting, it applies to both Rotary and Reciprocating, right? Because you do put a torque setting in for Pro Taper, even like Rotary, like Pro Taper Universal.
No.
Is Pro Taper Next rotational or reciprocating? Pro Taper Next is Rotary. I mean, I remember when I was learning about Pro Taper Next, they were like, it's swaggering. Okay, but actually, it's Rotary.
You just took the words out of my mouth. I was about to mention the swagger.
So I asked you, is it Rotary or reciprocating? You would have said swaggering, okay? Because that's what was on my mind, okay? That's the one, like, they brought swagger to dentistry. But jokes aside, it's a Rotary. But even when you use these files, you still have to set the torque.
No, you don't set the torque from reciprocation, because that's the whole point, isn't it? The file is only going one way, and then before it reaches that kind of elastic limit of the metal, it's going to be bringing backwards. And I think originally what they wanted was the cutting rotation needs to be longer than the release rotation, because at least then you're going to get some kind of movement towards the apex. And we were talking about reciprocation was used in the 90s. Well, that type of reciprocation was only back in 2. And what they found with that is it was ineffective, because there was it was just kind of juddering within the canal itself.
It wasn't advancing. It makes sense, because you need a little bit more in one way. Yeah, that makes sense. Yeah. But then you essentially, so the torque I understand now, but essentially what you're saying right at the beginning was that reciprocating has some advantages of less breakages. Is that right? Because of this feature that it has.
So they say. Again, it's the problem with studies and things in endo or anything. It's just almost impossible to kind of get a consensus. And this is what I was saying right at the start about I'm going to give you a wishy-washy answer, because it's just how you feel inside. If you feel like it's safer for you using reciprocation because you like the idea of this kind of movement is less likely to cause a torsional fracture, and also you think that's going to create a better centering ability as well. We were talking about the balance force technique, and obviously that's the reciprocation motion lends something off of that kind of technique. Again, you look at the evidence on centering ability, and it's all over the place. Some say reciprocation is great, some say Rotary is great. You obviously got that feeling of safety, and it's better for a less experienced dentists.
Okay, I was gonna say, doesn't reciprocating produce more debris?
So this is when we sort of move into the kind of benefits of using rotary. They say it's less likely to extrude material. So a rotary reaction is less likely to extrude material. We're talking about debris from the canal, be it sort of bacteria, or even you're doing a reroute treatment. And the evidence is broadly supported on this, but again, it goes down to a lot of factors. So what the design of the file, the taper, the technique. And in fact, one of the studies suggested that it produces the least amount of extrusion of material. I think another benefit of rotary as well is I feel like it's smoother. And again, this is kind of another, this is something that you decide if that is something that you think's good or bad. But one thing I noticed with reciprocation is it kind of got that kind of juddery effect, hasn't it? And you may or may not like that. I use a rotary file. I use HyFlex essentially because I started using it, 7 or 8 years ago, and I just know it, and I know it really well. But I feel like there's a better cutting efficiency with a rotary. HyFlex is rotary. I like the kind of smoothness of it. I feel like I get more tactile feedback as well. And what I mean by that is I can feel the canal, because essentially root canal is all essentially done by feel, isn't it? A lot of the times when you've got a hand file, because you're never going to get as good tactile feedback as a hand file because you've got it in your hand, haven't you? But I'm using this kind of if I'm getting to the apex and I can't quite get to the end, or can't get zero on my apex locator. A lot of the times I make a little bend at the end and I have a feel around, and I'm feeling for that apex. And sometimes you can feel that kind of ledge. You can feel something. I feel like I get the tactile feedback from the canal better with a rotary. But of course, I could use Wave on Gold for 8 years and feel like I get the same tactile feedback. So it's basically just objective, isn't it? I think another great thing about rotary is I feel like it's got a wider variety of being able to customize the way you when you treat teeth. I do get asked a lot about, what is my protocol, and it's pretty boring.
Well, there we have it, guys. Thank you so much for listening to me and Sam until the end of part 1, all the way to the end. We left you on a cliffhanger. He's just about to explain his painfully boring but ever so important protocol. How does he do his endos? So don't forget to tune in to part 2 to learn his protocol. Also, do not forget this offer on this endo motor. There'll be a recurring offer, but for the first 30 days from the time of publishing this episode, you'll get the stated offer, i.e. the highest discount. The website is protrusive.co.uk/endo motor. That's protrusive.co.uk/endo motor. If you've been looking and waiting for the right motor or a reliable motor, this is a great opportunity to speak to your practice, speak to your principal, and consider buying it. Having said that, I know many associates that buy their own motors. Extremely sad, I know, but I love you for it. This episode, of course, is eligible for CPD. We are a PACE-approved education provider. If you're watching this on the premium version of the app, scroll down, answer the quiz, don't forget, and our CPD Queen Marie will send you a certificate. If you're not on our app yet, what are you waiting for? This could be easy CPD that you can be racking up every week for just listening, and of course you unlock a whole bunch of courses and extra premium clinical videos as well. Head over to protrusive.app to start your learning journey. You'll come for the courses, but you'll stay for the community. And last but not least, don't forget to tune in next week for part 2. I'll catch you same time, same place, ladies and gents. Bye for now.